See, talking health, mental health, according to the World Health Organization (WHO), is a state of well-being in which one realizes one's abilities, copes with the normal stress of life, works productively and faithfully, and is able to make contributions to the community. Mental illness, on the other hand, refers to a wide range of mental health conditions and disorders that affect one's mood, thinking, and behavior. Examples of mental illnesses include depression, anxiety disorder, schizophrenia, eating disorders, and addictive behaviors. A mental health concern becomes an illness when ongoing signs and symptoms can cause frequent stress and affect the individual's ability to function. Today in Nigeria, many people have mental health concerns from time to time. We have in the studio this morning a medical officer at the Reconnect Health Development Initiative, Dr. Ilham Umar, to speak on the knowledge and attitude to mental health in Nigeria, and our Neem Capsule, a segment which highlights soft measures for tackling terrorism in the country. Good morning, Dr. Umar.
Good morning.
You're welcome to our studios.
Thank you.
Let's begin by looking at the knowledge of and attitude towards mental health among Nigerians.
Okay. Amongst a lot of Nigerians, there's a very large misconception and misinformation on mental health. There's a widespread belief that supernatural forces, such as witchcraft and evil spirits, cause mental illnesses. These beliefs we uphold have influenced the attitude of Nigerians towards the mentally ill. Historically, and actually still in some parts of Nigeria today, people with mental illnesses were burned, hanged, mutilated, abandoned, and restrained with chains, all in an attempt to save their souls. These beliefs have a huge impact on the acceptance of mentally ill amongst Nigerians. Therefore, mentally ill persons are frequently referred to as being dangerous, suspicious, unstable, or irresponsible, and even homicidal. These labels have further provoked stigma on mentally ill individuals. The impact of the stigmatizing attitude and poor knowledge of mental illness amongst Nigerians has shown to be a major hurdle to improving mental health in Nigeria.
All right, so since the formulation of mental health policy document in 1991, how much can you say has been implemented so far?
Okay, well, Nigeria's first mental health policy was formulated in 1991. This policy was implemented in order to ensure persons with mental disorders have equal rights as those with physical illnesses by integrating mental health into general health care services and ensuring there are qualified mental health professionals to provide the best healthcare services. However, due to the lack of centralized and comprehensive patient database, it makes it very difficult to track the gains of this policy. Our culture is deeply rooted in superstitious beliefs and religious predispositions, which often make it difficult for people in need to seek medical attention and receive proper treatment. Nevertheless, this policy has encouraged the emergence of specialized healthcare services such as Olive Prime Psychological Services and Sign-Up Services, just to mention a few. In general hospitals such as National Hospital, Karu General Hospital, and Garki Hospital, there are specialized healthcare professionals working to render the best possible services to those in need. There are also NGOs such as Reconnect Health Development Initiative, Neem Foundation, and Nyla Foundation that work to raise awareness on mental health, eradicate stigma, and support enhanced access to curative and preventive services.
So how would you say the implementation, how far has it gone, the implementation?
So far, people are becoming a lot more aware about mental health through the use of social media, through having fundraisers, having small circles in which people can have support systems to talk about issues that they have.
All right, so what ways would you suggest to Nigerians on keeping a healthy and positive mental health?
Look, before then, I want to ask you, is it true that every human being has a little bit of mental issue?
Okay. Anyone can have the propensity to have a mental health disorder, regardless of your age, your gender, your ethnic background. We all go through stress in life, and sometimes we become too overwhelmed to deal with those stress. So yes, there are certain factors that have been shown in research that can contribute to the possibility of developing a mental illness, such as having family history, having biological factors such as brain chemistry and genes, and life experiences such as trauma and genes. So, such as trauma and abuse. So it depends on what you go through in life and how you have figured out how to deal with coping mechanisms to determine whether you're able to deal with those issues or not.
So what ways would you suggest to Nigerians in keeping a health and positive mental health?
Okay, there are various ways. Just talking sometimes, talking about your feeling, telling someone you're close to, you're feeling stressed.
Anybody at all, or to a doctor?
It could be a doctor. So, there are points when you feel like you're unable to deal with your problems. You don't know how to cope with the issues that you have in life. So it's important to seek professional help. There are psychologists, there are psychiatrists, there are helplines in Nigeria available that you can call, talk to someone on the phone, tell them your issues without feeling like you're being judged, and understand that anything you discuss is confidential. The only point where those professionals are allowed to disclose information is if you feel like harming yourself or if you feel like harming someone else.
Don't you think that is a little bit alien to our culture? Because Nigerian society today, I share my problems with you.
Right.
Tomorrow you have a problem with me, and then you go telling everybody. So I'll be scared. I'll be scared of telling you my problems.
That's a very important question. But these are qualified health professionals. Whether it's your relative that you're dealing with, someone that's close to you, you have been trained to keep any information you discuss with a victim or a patient confidential.
So how best can mental health issues be handled, especially those around a victim?
It's important for people around you to notice if you're behaving abnormally, you're behaving differently, you're not being yourself, eating habits changing, whether you're acting confused. So it's important for people around you to notice those changes. And even you yourself, you can think, I'm not acting like myself.
So when you
I don't
start
feel
eating
like
too much,
sometimes we talk about eating disorder.
person's relation?